Hi, everyone. A little bit about me. I have a BS in accounting. I actually worked at the health district for 8 years and left 6 years ago, and then came back last year. So this all felt very familiar to me, except for the added excitement of a pandemic. So next slide. So the fiscal department ensures that the district's assets are secure and that internal control is maintained and that we're following our own policies and state and federal laws. We ensure that the bills are paid on time, coded correctly, and have proper supporting documentation. We ensure that our employees are filling out their time cards correctly and that we process payroll on time for our employees. We ensure that the district is billing correctly for services and following up on past due billings. And we have billings for customers and outside agencies, and this also includes the vast grant reimbursements that we take care of. We prepare the annual budget and provide periodic budget to actual reporting to the Board of Health. And you have already seen this in the monthly board meetings. And we request budget adjustments to the Board of Health when needed. And we assist the Washington State Auditor and other stakeholders with annual audits and fiscal monitoring of our agency. We have basically 4 people that work in our department, and then the clerks, we include them in fiscal. There's me, and then we have an accountant that processes our payroll and accounts receivable, takes our collections, and then just does a lot of stuff to support me. Contracts and procurement, they do all of the purchasing for our agency, and they track our contracts. And our fiscal assistant, which she mainly pays our bills. And then we audit the daily cash receipts and assist with billing. And then we do some training for our clerks because they are taking in money every day, balancing their drawers. So we are making sure that they have internal control there, making sure that they're ringing in fee classes correctly, making sure that their drawer balances. So they get some training also. Next slide. So the district fiscal year runs from January to December. The following year's preliminary budget is usually presented to the Board of Health at the September Board of Health meeting, and then monthly thereafter until December. And then we would ask the board to pass the budget in December for the following year. And so Luke and myself will spend according to the budget. And if there is a need to spend outside of the budget, the administrator will come back to the board to ask for authority to spend the funds. For example, we asked for authority to go out for RFQ for a designer. That was something we didn't have in our budget for 2022. So we came to the board and asked them to approve that for us. And the district's 2022 budget is $8,035,456. So the district submits an annual report to the state auditor, who we affectionately call SAO, no later than May 30th of the year following the end of the fiscal year. Besides reporting the district's financials to the state auditor, we also report the amount of federal and state grant funds that we expended for the year. And then SAO audits the district annually, and SAO will either do a financial audit or a single audit. If we spend $750,000 or less in federal funds, then they'll just do a financial audit. If we spend more than $750,000 in federal funds, then they perform what's called a single audit, which is a financial audit. Plus, they're auditing our federal program expenditures. And they need to audit at least 40% of our expenditures. So they'll pick a grant or a group of grants that equal or exceeds 40% of our expenditures. Next slide. SAO also performs an accountability audit every 3 years. And this audit tests the district's financial policies, confirms that the district is following its policies and state and federal regulations. And we are due for this audit in 2022. I'm not sure that they'll do this audit in August when they start our single audit, because we have to have our single audit results reported to the federal clearinghouse by September 30th. So I'm not sure that the auditor will have time to do both audits. So I imagine they'll come back this fall and do this audit. And we do we have additional fiscal monitoring performed by the Department of Health annually and by other agencies as requested. Some of those agencies include Department of Children and Family Services for our NFP grants, Healthcare Authority for some grants we have with them. So it just depends on what they're looking at, whether they want to do an end of the year audit, or they'll just randomly select us for an audit occasionally. And we also assist in monthly, quarterly, and annual program reporting as requested by the program managers. An example would be a WIC budget. We have to update that WIC budget every month and send it in, and that's part of my team's task. So on the operations side, I manage the clerks to make sure that there's adequate staffing coverage at both of our front counters, and that would be on the main floor and on the second floor, and that the clerks are supporting program staff. I also manage the IT director and the facilities manager. I oversee the IT needs, office space, equipment purchases, building repairs and maintenance, and then we also manage our fleet. And then of course, I also manage the fiscal staff. So for some of the IT projects that we've done this year, we've done an awful lot. Randy and I have done an awful lot. I should say Randy's done an awful lot. We've updated hardware, including new servers, firewall, laptops, and docking stations. And we're continuously upgrading our cell phones and iPads to facilitate field work for our staff. We are constantly updating our software for additional security. And we're going to be migrating to the M365 probably by the beginning of 2023. This will allow us, of course, more streamlined document management with OneDrive and SharePoint and Microsoft Teams for video conferencing. Right now, we're using a lot of Zoom, so it'll be nice to switch over to Microsoft Teams. Next slide. And then one of our big projects that's going to start, we actually have a meeting tomorrow for kickoff, is we're preparing for our environmental health records to be migrated to Smartgov web services. This is an online solution that will handle all of our environmental health functions, such as permitting, inspections, and online payments. It will also give the customers ability to look up some of their own information, which frees up our clerical staff. Right now, our clerical staff is manually looking at what we call as-built for septic systems that are needed by pumpers, realtors, all the different people when a sale goes through or whenever they need it. And it takes a lot of our clerical staff time. So we move those records up to the cloud and use this program, then those people can look up those records themselves. It will save us a ton of time. Smartgov will be custom designed to suit our needs for our environmental health departments, and eventually we'll be able to integrate into Chelan-Douglas County systems because they both use Smartgov as well. So the district has 7 vehicles. We have the Mobile Vax alternate care vehicle, and then we have some Ford, mainly Escapes and Explorers. Some of them are getting a little older. So we are in the process of purchasing 3 more vehicles that were approved by the board in 2021. It's just taken a very long time to get them. But it is one of the things that we're going to need to be looking at in the next few years, because we are having some repair costs with some of these vehicles. And what we'll do is we'll ask to surplus these vehicles and then probably sell them at the county auction, and then ask for the board to approve new vehicles being purchased. And then earlier this year, the district upgraded the building with the keyless entry and security cameras. And this provides additional security for our employees. And we also have a contract to sign to modernize our elevator. And we're hoping that this job should be completed later this year. And as you know, we have requested bids for a designer contractor to help us with the building improvements and modernization. So this is the end of my slideshow. Do any of you have any questions? No questions?
All right. Any other questions on Zoom, Darren or Dr. Hosey? All right. Sounds good. Move forward.